Starting the recording.
Okay. Good evening to everyone present here. I warmly welcome you all to today's VMS webinar session. Today, we are pleased to introduce Ms. Mridusmita Sonowal, who is a dedicated mental health nursing professional with a strong academic and clinical background. She completed her BSc nursing from NIGRIMS Shillong, followed by MSc in psychiatric nursing from NIMHANS. She is currently pursuing fellowship in geriatric mental health nursing in NIMHANS, reflecting her keen interest and expertise in elderly care. And Ms. Mridusmita brings with her 6 months of hands-on experience in intensive care unit and 1.5 years of experience as a community health officer, giving her valuable exposure across both acute and community-based healthcare settings. Her work focuses on promoting safety, independence, and quality of life among older adults. So today, Ms. Mridusmita will be sharing her insights on the topic falls prevention and home safety for the elderly, which is a crucial aspect of healthy aging and geriatric care. So now I give the remaining of the time to our speaker for today.
Hello, can you hear
Yeah,
me?
yeah, please, you are muted. You are okay, ma. Everything is fine.
Yes. Thank you, Ms. Lendina, for the introduction. Good evening, one and all present here. I will share my screen.
Please. Yeah. It is visible, ma. Fine.
Okay, sir.
You can do full screen.
Is it visible?
Yeah. Fine, ma. Fine.
Okay. So good evening to one and all present here. Myself, Ms. Mridusmita Sonowal. I am currently pursuing my fellowship in geriatric mental health nursing from NIMHANS. So today, topic of discussion is very common yet very important for all the elderly. That is falls prevention and home safety for elderly. So we'll move further. So today's objectives will be introduction, and we will know what is falls and also why falls prevention and how do falls happen. And also we will know the risk factors of fall, also along with the warning signs of falls and what can happen because of falls and the anxiety and the fall cycle. Then prevention and home safety tips we will know and how to get up after a fall, and we will conclude the topic. First, we will know what is your risk of falling. So I think everybody must have come across this poem that says Humpty Dumpty sat on a wall. Humpty Dumpty had a great fall. All the king's horses and all the king's men cannot put Humpty Dumpty together again. So here, the Humpty Dumpty is an egg which resembles the fragility because our life is very fragile, and when we get older it becomes more fragile. So keeping the health of our bone, our memory, our emotions are very important. And the next says that all the king's horses and all the king's men, that says that money cannot buy health, right? And life, and it says that authority cannot stop you from aging. And also some life changes are natural, which cannot be bought from money or any other resources. And the last is cannot put Humpty Dumpty together again. It's rather finishing the poem with cannot put Humpty Dumpty together again. Why can't we say that, like, how could Humpty Dumpty have done differently? And how could he sit somewhere else rather sitting on a wall? So this poem gives you an idea about how life is fragile, and it says that what is your wall in your life and what helps you stay balanced in your life, and also who is your kingsman, that is known as the support system of your life. And also after a a fall, what help you keep the balance in your life? So we'll move forward.
Yeah, please.
Yes, so we'll know the introduction. So most of us have experienced fall in our life at some point of life, right? So having a fall will be nothing more than a bit embarrassing for many of us. However, a fall can be startling, upsetting, and or even can be life-changing. So especially for the people who are getting older. So falls is not an inevitable part of getting older, but can also become more common and can be harder to recover from it. So, according to some research, it says that every 3 minutes, someone has a fracture because of fall or because of osteoporosis. And 40% of the care home admission that results from fall. And it says that 18 to 33% are having the risk of mortality in the first year after having a hip fracture that can happen after a fall. So, what is false? According to WHO, that is World Health Organization, it defines a fall as an event which result in a person coming to rest accidentally on the ground or floor or other lower levels. So falls are more recurrent in the elderly population, that is 65 years and older. Falls are becoming an increasing public health problem because the aging population is increasing due to longer life expectancy. So why falls prevention? Why do we need to prevent fall? Because this is a leading cause of unintentional injury, which is mostly among the residents ages 65 years and older. And this also a leading cause of hospitalization nowadays. And 60% of the falls takes place inside the home rather than outside. How do falls happen? The falls can be accidents or can be environment. This, according to a research, it says 43% of the falls happens due to accidents and environment, where 30% of the falls due to any loss of balance or due to dizziness. And dehydration and poor nutrition is also due to which the falls can happen, and medication is also due to which the falls can happen. And now we will know the risk factors of fall. The first can be any foot problems, and the second is age related. As I say that our age is very fragile. When we are aging, the risk factors of the fall increases, and impaired vision or hearing impairment is also a risk factor for falls. And the next is any acute illnesses, maybe fever, maybe weakness, then confusion also a risk factor of fall. Then balance or gait is also a risk factor. Then medications and external hazards. So we will know about it when we'll be further going on to our slides. So now what are the warning signs of falls? Warning signs when you are finding difficulty getting up from the chair and any unsteady walking. Frequently you are feeling dizziness, maybe every 2 to 3 times a day, and any previous history of falls is all. These are the warning signs of falls. Now, what can happen because of fall? The potential consequences of falls can be death, can be small or major injury. It increases the hospital admission. The loss of mobility and function is also impaired. The loss of independence. You won't be able to do your daily activity independently. Then social anxiety or social isolation will also be there. Then fear of falling, because you have a history of falling. So fear of falling will always be there. Then it will also show in depression. The next is anxiety and a fall cycle. Now, what anxiety causes in a fall? It's like after a fall, a person is likely to have a fear of falling again. This always a normal person will also feel the same. I'm not only talking about an elderly or an aged person, but it happens to all the individuals as well. Because once you have fall, you might might always think that I might fall again. So that anxiety will always be there. So this often means they become very less active, which leads to poorer muscle strength and balance. And of course, this increases their risk of further falls, which call this the fall cycle. So now we will see how this fall cycle was. First you will fall, then the fear of falling again will always be there. Then there will be less activity. You will always feel like not doing anything, or you will feel like doing less activities, because that fear, that anxiety of falling again will always be there. So when you are doing less activity, you are not actively participating in any activities, there will be ultimately decreased muscle strength and balance. Then when you have decreased muscle strength, there will be again the increased risk of falling is there. So this is a cycle. Once you have fall, then again the fear of falling is there. Then due to that fear of falling, you will be having less activity. Then when you are doing less activities, your muscle strength will be decreased, and your balance will be decreased. So you have again increased risk of falling. So this is a fall cycle. So now we will see the how you can prevent falls. Like falls prevention is about identifying and manage the risks related to your health, well-being, and also the environment. This will include, first we will see the preventing of falls, then we will see the home-based care that you can take to prevent the falls. First you can do is vision check, where detect poor depth in perceptions. Where vision is unclear, older adults may misjudge steps, curbs, or uneven floors. This increases the risk of tripping or missing a step. The second is ensures correct prescription glasses, where outdated or incorrect glasses can distort vision and depth perception. Regular checkups ensure proper correction. And reduces nighttime fall risk, where poor night vision increases falls during bathroom visits at night. Vision checks help identify problems like reduce low light vision. So to reduce the falls, you should always visit the doctor to check for your power. If I see in a very simple language, to check your power, because if you are wearing wrong power glasses, definitely you have the risk of increased risk of tripping or missing any step while going to bathroom, or while going to while changing rooms, or while walking through the streets. So you should always regularly go to your doctor for your correct eye checkups and for correct glasses. And the next is review your medication. For reviewing your medications, before reading the entire slides, I would like to tell you very briefly that while we age, people tend to take so many medications due to several other comorbidities in their life. So mismatching or mixing of medication can increase falls, because this might lead to dizziness, or also some medication makes you feel drowsy and confused as well. So always check with the medication along with your doctor, and you should always take it in a correct time and in a correct dose. So identify drugs that causes dizziness. You should always identify and ask your doctor ask your doctor about the side and symptoms, the symptoms of the side effects of the medications, if it causes any dizziness, because some medication lower your blood pressures and also affect your brain, causing the lightheadedness and imbalance, and also prevent orthostatic hypotension. We always feel dizzy or blackouts suddenly when we get up from the bed. So I would suggest you one thing, that when you are getting up from the bed, do not be hurry. Always try to sit for maybe 2 to 3 seconds at that same position and get up from the bed, because this will prevent from orthostatic hypotension, and also it will prevent you from falling. Then reduce sedation and drowsiness. Sleeping tablets, these are the more common that I have, or in my entire experience, that I have seen that sleeping tablets causes a lot of falls, because people sometimes they take it, they overdose it, and the increase of fall is there. And sleeping tablets and anti-anxiety drugs is also there. And some painkillers can also make the patient feel sleepy, and also it can lead to falls. Then minimizes confusion and delirium. Certain medications, as I have always as I have said, that can cause confusion, and especially in elderly, can increasing unsafe walking and gait, might be disbalanced as well. Then avoid drug interaction. Multiple medication taken together can increase the side effects like weakness, blurred vision, or unsteadiness. Then adjust doses according to age. Like kidney and liver function decline with age, the doses may need reduction to avoid the toxicity. So this is all about review of medication. The next is regular exercise. As we all know that how regular exercise is important, not only for an aging adult, but also for everyone, from child to adult to old age. Everyone need a regular exercise, not only to prevent falls, but also to keep holistically healthy for a person. So to improve, definitely for this, as we are talking about prevention of falls, this would definitely, the regular exercises is necessary to improve the muscle strength in a person, where strong leg and core muscle help in standing, also helps in walking and recovering from a slip. Then enhance balance and stability, where balance training reduces swaying and improves control while turning or changing direction. Then increase your joint flexibility, where flexible joints make movements smoother and reduces stiffness related imbalance. Then improve gait patterns, where regular walking or physiotherapy corrects shuffling gait and improves stride length. Then reduce fear of falling. As I was talking in a previous slide, the cycle of fall, where reduces fear of falling. When here in regular exercises, when you have a fear of falling, your exercise, your activity reduces. But here, this the prevention of falls, here this is a point that reduces fear of falling. If you are doing continuous exercise, this will improve your confidence also, which reduces caution, stiff walking, and actually increases the fall risk. Then maintains bone strength. Weight-bearing exercise helps maintain the bone density, reducing fracture severity if a fall occurs. Weight-bearing exercise, I would not say that you go to gym and you weigh a very heavy weight, but it's according to your strength. You should always consult to your conduct a training, always take a trainer, or always take the help from your physiotherapist or your doctor. Consult before any heavy weight bearing exercises, because that might again lead to any other severity of maybe you might have some pain, also the breakage of bones as well. So you should always keep this in mind. Then improve posture. Better posture means better center of gravity and balance control. Then enhances cardiovascular health as well. When we say that you are having high BP, you are having high sugar, we always recommend that you should walk at least 10,000 steps a day. So better circulation reduces dizziness and fatigue during the movement. This is all about the regular exercise, how regular exercise helps to prevent falls. Next, let's look at the home. That is in-home safety tips. Like what are the things you should be taken care of when you are inside the home, as the falls inside the home is much more increasing nowadays rather than the environment outside. So the first, you should take care of the entrance, where in entrance, you should, I think you can see two pictures here, how clear and how clean, clutter-free the environment looks like in here. So to install the sturdy handrails, you should always put a handrail to provide support while climbing or descending the steps. And also the handrail should be very sturdy. It should not be very flimsy, and for an easy grip. You should always use an anti-skid mats in front of your door. The anti-skid mat, I think most of you have already seen, or most of you are already keeping it in your home. And those who are not keeping, you can always buy it in any local store. That anti-skid mats, this is the mat that will not prevent you from falls, and it will prevent slipping during the rainy or wetty conditions as well. So ensure proper lighting also, then bright light at the entrance and the staircase. Install motion sensor lights if possible. There should be lights in front of your door or any of your entrance. There should not be dark to prevent from any fall. Then avoid unseen surfaces, like any cracks are there, or anything which is not seen should be avoided to prevent from falls. Because in most of the houses there are some broken tiles or broken tiles, or the stones are there. So we should always keep it in mind to keep it aside, or to avoid it. Keep entrance clutter free, as I have already told. You can see in this picture clearly that the surface in front of your door should always be clutter free. To remove the shoes, wires, or any flower pots from the walkway. Flower pots you can keep definitely, and everyone likes to put the flower pot, but it should be kept in a position where it does not disturb your walking area. And keep the pathway wide, and it should be clear. Then provide ramp with raining, as it is already told before in the first point as well, that there should be a ramp with railings, and the railing should be sturdy. And most of the elderly uses wheelchair or walker. So for their benefits, like we can always use a walker where the wheelchair or the slanting position, where they can easily take the wheelchair up and descending step. Then highlight step edges, like during night mostly we tend to not see the staircases or the steps outside the door, if there is any maybe due to poor vision or maybe poor lights in there. So we should always, if possible, we should always skip a coloring tape, or maybe fluorescent or neon tape that is useful when there is less lights. It radiates the lights, so that is very useful to reduce the falls. This is all about the entrance. Next, we will see in the living room. So in the living room, here you can see in the living room where keeping the walking areas clear. You can see in the photo in this picture where the living room seems very clutter-free, very clear, and everything is kept in the place where it should be, not kept here and there, and nothing is in the floor. So it looks very clear. So the living room where the keep walking areas clear, because while going to the sofa, or while going to the maybe a nearby couch, the path should be always clear. You should always remove the unnecessary things from there, and to clear the pathway. Avoid slippery or loose rugs. We always keep a rug in our living room. We should keep in mind that rug should be sleep proof, because living room is the place we always been to. Maybe like entire day, at least of 10 times we go to our living room, right? So the rugs in there, this is very prone for accidents or for slipping. So you should always keep it in mind to use anti-slippery rugs. Then secure electrical wires, like all the wires, like our televisions are there, maybe our radios are there. So there are many wire connections which is there, which is connected to our living room. So we should always keep it in mind to secure the electrical wires, not to be cluttered everywhere, and keep it maybe in a safe position so we cannot reach to that. So maintain adequate lighting. There should be adequate lighting in the living room then unused table and supportive furniture. The furnitures are also very important to prevent from falls, because there are many incidents that I have seen, like one chair is there, that is the swing chair that many elderly or many youngsters also and many adults also nowadays are using, but that is very prone to falls, because some while swinging, people are using it in a wrong way, and while swinging they tend to fall, or maybe they are keeping it above a slippery rug, which tends to tends for a fall, or this happens with accidents. So this is all about the living room. Next we will move on to the kitchen. Here you can see few pictures of the kitchen, where the kitchen is also since clutter free. There is a rug, anti-skid rug, that one is using, and the third picture says that the how everything they are keeping in a very reach out positions, like you do not have to search here and there. It's very handy, like you can search it, you can get it in a single place, very clutter free. So in kitchen, use non-slip mats, as you can see in this photo, where this should be put in the near the cooking area or near the sink, because near the sink, when you're doing your dishes, you spill out water, so that also can cause fall. So you should always that is waterproof and non-slip mats you should always put. Then clean the slip spills immediately. When you know that there is some water spills, try to clean the water spills immediately, right away, to prevent any slipping. And keep frequently used items within easy reach. As you can see in this third picture, like always using the salt you use, the turmeric you use. These are the normal we use every day, and the utensils which you use every day, or the groceries which you use every day. You should always keep it in a place where you can reach it very in just within your hands, to avoid any excessive bending or excessive climbing, to prevent from falls. And you should always ensure that there is bright lighting in the kitchen as well, to identify any wet areas, obstacles, or uneven surfaces. Wear safe footwears. Avoid walking barefoot. Use well-fitted non-slip footwear inside the kitchen. So this is all about kitchen. The next we will move on to bedroom. Here you can again see in the bedroom, the first picture says a light, a dim light, right? And the next is the bed railings. And the third is position, the position of the bed, where the leg should not be swinging in the air, where you do not have to bend down to get down to from the bed. So the correct position is when you are sitting 90 degree, your knee angle is 90 degree, and your feet is touching the floor. So that is the correct height of the bed you should be using. So you should always use a night light in the room, because while the tube light or the light on, you will definitely not be able to sleep, or disturbances in sleeping will be there. So you should always use a dim light or a night light in your room, because while maybe during night time you want to go to the washroom and you are not able to see anything, while before reaching the switchboard to on the light, you might fall. So to avoid the accidents, you should always put a night light in your room. Keep pathway clear. Ensure that there is no stools, wires, or clutter between the bed and the door. Then maintain proper bed height, that I already told you. Then and it should not be too high, and it should not be too low as well. There is always a small bed. There should always be a small bed table near your bed, so that you don't have to again and again get off your bed to get the things like your phone, maybe your eyeglasses, maybe your water and medicines. You should always keep it nearby your bed, maybe a small bed table, to again and again going off the bed. Then wear non-slip slippers. Avoid walking barefoot, especially on smooth or tiled floors. So next we will see office. In office, first in picture, we can see the before and after, where before the wires are very cluttered. It is kept it is looking very cluttered. But in a second picture, as you can see that how beautifully they have kept the wire. It is looking clean, neat, and also clutter free. And the second one is the anti-skid mats that should be kept in the office. So here in office, keep the walkway clear as always. I think from the first slide of the home safety, I have been telling that keep the walkway clear. We should always keep in mind to free from any baggages, boxes, or loose objects that can cause any tripping in the office. Then secure the electrical cables, as you can clearly see in the photo how cluttered free it looks. It also prevent from any accidents because it might get tied in your leg, it might fall. So you should always take care of this electrical cables as well. Then use non-slip flooring. So in the office, this the second picture, so you can see that how this non-slip flooring you can keep. This is not polished. This comes in a rough surface or wet rough surface where it is waterproof also. If there is any spills of water, this will not lead to any falls. Then use stable adjustable chairs. When you are sitting in a chair, the chairs tend to move or you are swing. So the higher than sitting in maybe a plastic chair. So you should always keep it in mind to sit in a stable chair to avoid accidents and maintain adequate lighting in the office as well. So one of the important following, because laundry is the place where
Mridusmita, I think you are getting, this thing is not okay.
most
Yeah,
of
kindly adjust your, Mridusmita, Mridusmita, Mridusmita. You are. One second.
Sir, her signal is
Sir,
red. Her signal is weak. Her
Yeah,
signal is weak.
wait, sir. I'm telling her.
I will
Sir.
contact.
Yeah,
Yes, sir. Sir, I will contact the speaker and inform.
Yeah, she will contact the speaker, and we are managing this, sir. There is a problem with her this thing. Connectivity. We are managing it. Kindly, kindly be calm. We'll separate it fast. It will happen fast. Don't bother, sir. Yeah, she has come back. Yeah, she has. Yeah. She has come back. One second. One second. Kindly hold on. We are trying to reach her, reach the speaker, and she will come back with the better this thing. Network. There is a problem with network. It's being addressed. There are some downsides in any presentations or anything, any technical related things. So this side, downside is because of that. We are addressing it. Kindly hold on. Technology has got some sides and downsides also. 1 second. Dr. Sudhakar has sent you a message. Sir, this is being addressed, sir. We have got our own YouTube channel. This will be uploaded in our YouTube channel, sir. You can always view it. The YouTube channel is also known as Vayomanasa Sanjeevani. Once you type YouTube, you go to YouTube and type Vayomanasa Sanjeevani, you will get our YouTube channel. There it will be uploaded in a couple of days. Yeah, she has come back. You are unmute yourself, ma. Mridusmita.
Yeah, can you hear me, sir? I think there was
First class.
some network
First
issues.
First class, no problem.
Yes, I'll
Kindly
try
share
to
your
share.
screen, ma. Yeah,
Yes, sir,
share
yes,
your.
sir.
Share. Yeah. It has
I
come.
think from here I will start, sir. Laundry.
Please. No, but you have to go to the previous one, ma. The previous one.
This one?
5. Office. Last item in the office. Then you go to laundry.
Okay, sure, sir. Okay.
Adequate lighting. Maintain adequate lighting.
Okay. So in the office, which I was telling that we should always be the walkway should be clear, and also the secure electrical cables where you can see before and after, that is very cluttered. And the second picture, it shows clutter-free pictures of the wires. Then always use the non-slip flooring, where you can get a non-slippery flooring with waterproof mats, where if any spills are there, the water will be soaked, and that will be prevent from slipping or any accidents. Then use stable and adjustable chairs, where the chairs should be stable. There should not be swinging or rounding chairs, where most of the accidents happens because of there. Then maintain the adequate lighting of the office to maybe to the corridors or to the staircase and to the work areas as well. So this is all about the office. I will move forward to laundry. In the laundry, as you can see in the photo, the two pictures, where laundry is the place where most of the accident happens because of the water spills, because of the soap, the detergents, everything that is in the laundry. So we should always keep it in mind to keep the laundry clean, and also spill free zones where the water should be clean as soon as there is a spill. So in laundry also, we should use a non-slip mats as you nearby your washing machines, and also near your water sources, the pipeline where the water comes to the washing machine. We should always keep a mat or soaking pads or soaking mats to soak the spill water there. Then clean the water spills immediately. If you're seeing any spill of water near your laundry, then you should always clean it immediately to avoid from any accidents. Then avoid carrying heavy loads. Like in laundry, we should keep it in a laundry box or laundry bag. So it should not be that heavy. It should always be lightweight or the adequate weight, because while carrying that, if it is too heavy, definitely anyone will fall. So you should always avoid carrying any heavy loads. Or you can always use a wheel bag that we get, that is a basket that has wheels, to avoid any accidents. and store items at easy to reach height. Like in laundry also, you should always make a compartment where it is very handy and it is very easy to reach, so that you can always get your detergents, maybe always you can get the switchboards of the laundry. So you should always store the items in easy to reach height. Then ensure proper lighting in the laundry, because if there is any spills there, if there is no lighting, there will be chances of slipping in the laundry is there. So this is all about laundry. Next, we will move on to stairs. This is where most of the accidents and most of the falls happen, right? So in the stairs, if possible, always put lighting in the stairs. Like I can show you, you can see in this photo, the second photo, that there is a proper lighting in the stairs. If not this lighting, where most of the houses where they are keeping the lights, only the lights will be there only where the stairs are there, and while sleeping, because in at night when everybody is sleeping, they tend to switch off the lights. But if your room is upstairs and you need to come downstairs for your washroom, or if you're going downstairs for to your kitchen, then you have to climb a stairs, or you have to get down the stairs, and you are unable to see the stairs, and the switchboard of the light is downstairs. You are nowhere that you can find the switch on the lights, and you do not have any mobile phone to switch on the torch. So in that place, this small lights in the stairs helps out. And another thing that you can see in the first picture is the slip proof. Some tapes we get because while climbing down the stairs, uh, many people and most of us slips, and this is a very common accidents that we are seeing nowadays. Not even, I'm not only telling about the elderly people, but also small children's, also adults, also younger people also tend to fall in the stairs. So if this mats have grips, and this prevents from slipping from the stairs. First, if you see that, install a strong handrails. Where climbing down the stairs, there should be a proper handrail. Well, if you're slipping also, you can grab onto the handrails for further aggravating of the accidents. And also it provides support while climbing and while descending as well. And apply anti-slip strips, which I have already told you and already shown in the first photo. And ensure lighting also, I have told you. Then use contrasting markings. Markings are also there. If you are unable to find the lights, there are some contrasting color tape. There's, if you remember in the first slide of preventing the floor, preventing the falls in the floor outside your house, I have told that while climbing the stairs, you can put a fluorescent or a contrasting color tape, when you can visualize the steps very clearly. Like the same, you can use it in your inside home safety purpose as well, for a better visualization of your stairs, because most of the times we do not see the stairs, and we tend to slip in the stairs. Then hold the rail and avoid rushing. You should always be calm while climbing or while getting off the stairs. You should always hold the railings or bars, grab bars in the staircase while climbing. So this is all about stairs. And the next is bathroom. Bathroom, I guess, is the place where I think the fall happens the most. So first pictures, you can see that near the toilet seat, there is a grab bar, because most of the people, when sitting in the toilet for a longer time, tend to feel dizzy while getting up. So and they do not find anything to hold on to. So this grab bars helps a lot when you are feeling dizzy, to prevent from any falls. And the second picture is the mat, the slip-proof mat while taking a shower, when there is soap spills, and or if after shower, if this floor is wet, there will be slip and there will be falls. So you should use the slip-proof mat and waterproof mat in the bathroom. So first, install the grab bar as you can see in the photo, and use non-slip mats. Then use a raised toilet seat if needed. Make sitting and standing easier, especially for those who need pain and weakness. And use a shower chair. Sitting while bathing reduces risk of slipping and fatigue. There is a shower chair, or you can use a small stool while taking a shower to prevent from any falls. And ensure bright lighting in the bathroom, because to identify any wet floors or to improve the visibility during the night time use of the bathroom. So this is all about bathroom and the preventing of falls. Then next is the general safety of falls. Proper footwear. The footwear which we are using should be well fitted, and should avoid any loose slippers, or choose non-slip soles. Avoid walking barefoot on smooth floors. Like the shoes which you are using or which you are wearing should be finely fitted your legs. It should not be too loose. It should not be too tight to walk. It should be according to your to your fit size. And you should use a sleep proof soles, which will prevent you from any falls. And you should use a very soft sole, not too hard, to also prevent from any soreness, also prevent from any other accidents. And to avoid walking any barefoot or on the smooth floors, like in tiles, mostly in tiles, where if you're walking barefoot and if there is any water spills, then you will be having a fall. The next is use assistive device correctly. Here you can see in the photo that she is walking with a walker, and also in the second picture, the person is walking with a stick. But the first position where the person is walking is correct. It is not too bent. It is not too straight. So this will make him comfortable also, and it will help him to walk correctly. But the second photo, where the stick is too long, the person is standing very straight, which is making him little uncomfortable to walk. And the third picture also, the stick is very short, where the person has to bend a lot to walk. So that is also making him very uncomfortable, and this might also lead to back pain as well. So the first picture where the person is taking the stick is the correct position or the correct size. The use of assistive device, where walking stick or walker when prescribed, you should only use it when prescribed, and ensure the correct height adjustment and regular maintenance of the device. So the next is proper nutrition and hydration, which is the utmost necessary. To prevent weaknesses and to reduce dizziness from dehydration, adequate calcium and vitamin D for bone health. You should always drink water. Maybe everyone knows that 2 to 3 liters of water is necessary in a day to prevent from any dehydration and to prevent from any dizziness. As I have already told, that many people, or mostly the elderly, they tend to take a lot of medications together, so which makes them feel dehydration, sometimes dizziness. So drinking a lot of water, an adequate amount of water, helps a lot. And adequate calcium and vitamin D for bone health, along with the exercise, along with the safety tips, we should also take proper nutrition and hydration care as well. And also, mostly important, along with the food, for vitamin D and for bone health, we should take sun bath in the morning, at least for 30 minutes, 15 to 30 minutes a day. We should always get in the sun for vitamin D. So this have come to the end. Now we'll see how to get up after a fall. This is a very basic. If you have fall suddenly, accidentally, roll onto one side. You can roll onto one side and push on to your hand. With one hand, you can slowly push on, then push up to your hands and knees to crawl. Like, then you can slide onto solid furniture, strongest leg next to it, foot flat on ground, not only to furniture. If you have any strong anything, any strong material near you, then you can hold on to. You can you can keep your foot flat on the ground, then push up and turn slowly, then rest and check for any injury. This is a basic. Then if you have fall suddenly, how to get up from the fall. If you have no one around you, then you can use this technique. The next, I have come to the conclusion. Falls in the elderly are very common, but it is preventable. But simple measure like regular exercise, medication review, vision checkups, proper nutrition, and home safety modifications can greatly reduce the risk. Then preventing falls help maintain independence, confidence, and quality of life in older adults. So there is a sweet take-home message for you all. Falls are not a normal part of aging. They are preventable. This is all about today's session. If you have any question, you can ask me. Thank you, everyone.
Thank you. Thank you. It was a wonderful presentation. I appreciate you for
Thank you.
a beautiful textbook presentation. Beautiful. In fact, very, very practical, and people will be very much benefited. There are 2 or 3 doctors in this webinar now. Now they have also mentioned, two of the doctors have already mentioned. They have appreciated your presentation. Anyway, I will request, before going to them, my first question is this. See, these are all the days of, where we go in for some kind of preventive checkups. So, what is
Yes,
the
sir.
preventive checkup for the falls? Why it can help? And can, NIMHANS help us in any way? This will be very useful to us. Kindly talk on that. Then we will go to the doctors and the general people after that. Thank you, ma'am.
Yes, sir. Thank you for your question, sir. Sir, for the preventive measures, because falls happens accidentally, it is not predictable that tomorrow I will fall or someday I will fall. So always preventive. We always say that prevention is better than cure. So for the preventive measures, NIMHANS definitely we provide the preventive measures for the falls in our nursing clinic. That is, we every day we do this tuck test for the people who are having any history of falls or who are prone for any falls. So if they are prone for falls or if they are having any history of falls, we always educate them with all the things which I have shared with you today. And we always ask them to come for the follow-ups regularly, and also we do the tele follow-ups for them so that we can get an update of any falls if they are having. Or and the thing is that we ensure that along with the medications which they are taking, because as I have already mentioned that many elderly, they are high on drugs. They are taking maybe 5 to 6 medications together, maybe because of BP, maybe because of high sugars, and maybe because of many other comorbidities. And due to which this falls is a side effect, which I can say. This is not actually a disease, which is a side effect that can cause from many of the medications, and also maybe due to the side effects of the medications. So we always tell them to educate them, psychoeducate them about the risk of falls and also the prevention of falls. And in NIMHANS, we provide them. In NIMHANS,
What fall risk assessment? In fact, what I meant was that what is the fall risk assessment and is it available at all places? See, the one point is that, yes. See, supposing
yes,
you want a blood test or something like that, you can go to a lab and ask for that. But something like that, is it available? That's my second question, ma'am.
yes, sir. The fall risk test that we do in our clinic in NIMHANS, because we're nursing, we are doing the fall risk test regularly, almost every day. That is, we do a minute of test where we ask the patient. It is not a blood test. It is a small assessment test that we do to the patients who are coming with a fall risk or a history of fall, that we provide, that we ask the patient to do a small assessment which is done in 20 seconds. So if there is any fall risk, then we educate. Sir, any rather of that, if any blood test is there for fall risk, that which I am not aware of, but in NIMHANS, sir, this tuck test, this fall risk assessment we do in our nursing services.
Yeah, that is what I meant. See, fall risk assessment. Okay. Thank you very much for that, ma. See, any other person would like to talk? Please unmute yourself and talk. Any other doubts?
Hello. Namaste, Jambunathan sir and
Yeah.
Mridusmita ji.
Yes, hello.
Am
Yeah, tell
I
me.
audible?
You are.
Okay. Mridusmita, I just would like to know what is the first aid we are expected to take immediately after a fall? Of course, immediately the getting up steps and other things, you showed it very clearly to us. Okay. Is there any first aid we immediately have to, go in for?
Yeah.
Yes, thank you for the question, ma'am. For the first aid, first we need to check that how the injury is. Is it very small, or is it very major, or it is manageable at home? So first you have to look for the injury first. So if that is manageable at home, if there is a small injury or cut, then definitely you can manage at home. But if the injury is high, or if it is very major, that you are having a very big cut, or you are having a pain in your hand which is irresistible or which is very much aggravating, then you can always proceed to the nearby healthcare without further delay.
That is the only thing. Okay.
Yes.
The
That is the
kind of-
only first aid thing that you can see. But first, you need to know that how the injury is, because some injuries, if you have fall, that is very major, which is maybe that makes bleeding, that's cut. Maybe then definitely you have to proceed to a nearby healthcare institutions. But if the injury is manageable at home, if if a small cut, or maybe a small cramps, then
Swelling and
swelling, yes, definitely. But maybe you can wait for a day if the swelling increases, because suddenly, like in maybe in 1 hour,
internal injury.
yes, it will, but it will aggravate later at night, maybe the next day, maybe. So you can definitely approach to the nearby healthcares.
Okay, especially I'm concerned about these head injuries, especially when when you are climbing down the steps by chance, okay, in
Yes,
spite of
yes.
taking all the precautions, it sometimes happens that in case of a head injury. So
Yes,
because
in
that will not
case,
come to know, we immediately will not come to know, okay, nothing has happened, and we just tap our head where it's affected, and then we just keep
yes,
quiet.
absolutely, ma'am. For these head injuries, if you are knowing that, and you are aware that the person who has fall has got injured in the, or has hit their head somewhere, and you are not seeing any injury, any external injuries, then it's better you should always consult a doctor and approach to a nearby hospitals, because if there is any unseen injury, if there is any external, if there is no external bleeding, then it is always to be confirmed, and for their benefit only. So we should always proceed to the nearby for a proper, at least for a checkup.
Thank you, ma'am.
Okay, madam. Thank you very much.
One second. Dr. Mahesh.
Doctor.
Would you like to add anything, Dr. Mahesh? Dr. Mahesh is a practicing geriatrician. So if he likes to add anything, we can ask him, or we can go to the Mr. Tangaraj.
Doctor, sudden giddiness is one of the reasons for falling down. And during sleeping also, the people are like to fall down from the bed itself. There are two issues are there.
Yes, sir. Yes, sir. These are the more common, these two are the most common fall that you have mentioned, and also I have shown in my slides as well. So for the prevention, because certain giddiness and falls at night are very common, and all these are common in elderly. So and this happens mostly, one factor is aging, and the next factor is maybe due to lack of disturbance of sleep, because when you are not having adequate sleep, that also makes you feel weak, giddy, and also you are not able to sleep at night. And also the third thing is that when you are taking medications, and that too, so many medications together, that also make you feel giddy, and also that will make you feel very dizzy. And so that's why, to prevent that, because you cannot stop the medications. The medications are given to you for some reasons, for some treatments that you are going through. But the preventive measures that you can take is, we usually use this for the small kids, because the small kids are put in a bed with the side railings up, because we know that the small kids might fall. But if you are thinking the same, the elderlies have the same issues as well. So at night, to prevent that, at least keep a side railing up, so that if they are moving around the bed also, they will not falling. And also during while getting up from the bed, as I've already mentioned, that the orthostatic hypotension is there, because while getting up from the bed, if you're suddenly getting up, then there will be a small giddiness or small dizziness or small blackouts will be there. So to prevent that, when you're getting up from the bed, do not rush out of the bed. Just sit for at least 2 to 3 seconds, or mostly, or maybe maximum till 5 seconds. Then you get up from the bed, relax. Then you will feel that the giddiness and the blackoutness will reduce, because this happens in not only to elderly, it happens to most of the youngsters nowadays, because of this happens mostly because of dehydrations, because of poor nutrition as well. So these are the basic preventions that we can at least follow to prevent the injuries from falls, from bed falls, and from accidents.
Thank you, ma. See, Mr. Gangaram is also there, sir. Would you like to add anything, sir? Mr. Gangaram is the retired Additional Chief Secretary of Government of Karnataka. He's an IAS officer, retired IAS officer. He has retired recently. Sir, would you like to add anything, sir? Gangaram, sir? No, I think he's not there. Okay. He's not unmuting.
Yes,
Sir,
sir.
Mahesh, sir? Mahesh, sir? Dr. Mahesh? Oh, he's okay. Dr. Sudhakar? Sir, would you like to add anything, sir?
Sir, I am a children specialist.
Yeah, yes, doctor. Yeah, very much needed. See, we are also like children, only the old age people.
So this is a little strange. I mean, not a familiar subject for me. It's all
Okay.
new and very welcome.
Yeah, yeah. Would you like
Thank
to
you,
add anything, doctor? Would you like to? She has made a beautiful presentation. No doubt
Yes,
on
sir.
that. Yeah.
No doubt.
Yeah, no doubt on that. But if you like to, from your experience, if you like to add anything.
Right now, I don't have much to add, sir. Her information was very extensive. Very thankful for her.
Thank you. Thank you. Thank you.
Thank you. Thank you so much, sir.
Thank you. Thank you. If there are no other questions, the time is already up. She is also a busy woman. Doctor, okay. I mean, the only last question I like to add is that the fall prevention exercise or the fall prevention test or the fall risk assessment, you say that it will not take more than a minute or so, isn't it?
Yes, for the assessment that we do, the tuck test and the small assessments that we do, because in OPDs, there are a lot of patients. So we see a lot of patients a day. So for the proper assessment, we do a detailed follow-up for the patients. But for a quick follow-up, we usually do a tuck test for the patients. So that does not take maybe more than 5 minutes.
I see. Thank you, ma. Thank you. That's beautiful
Yes.
information. Therefore, I would request
Yes.
all the seniors, whenever it is possible, let them take it, so that they know what
Yes.
is the risk they are facing. That's fall risk. In fact, I have done my fall risk assessment. Like that, I would request everybody to do that, so that we know where
Yes.
we stand. That's, I mean, prevention
Yes,
is
sir.
always better. So thank you for that. It was an excellent presentation. Many people have appreciated your presentation, ma. Although it is your first
Thank you
presentation,
so
as
much.
I know, many people have appreciated it. I mean, you have got a bright future before you. That's all I can say.
Thank you so much. Thank you so much. I also thank Thangaraju sir, Jammunathan sir for giving me this opportunity, and also I thank Lendina and for giving me this opportunity, and also all the participants who joined today for my presentation. And I believe that I could give justice to the topic and also could provide some information with you all. And also, I look forward for some more topics like this in future. And
In
thank you
fact,
so much.
we would love to listen to you in the future also, because this
Thank you
it
so
was a
much, sir.
beautiful presentation. I think this is the kind of presentation that seniors will be more interested and seniors will be actually practically benefited. Thank you very much. Okay,
True, sir.
Sanjana ma'am,
True, sir.
if
Yeah,
there is,
okay. Yes,
yeah,
thank you so much, Ms. Mridusmita, for the very comprehensive and insightful session. So our session is over. The YouTube link for this session will be shared soon in various groups. So thank you so much, everyone, for your active participation.
thank you, VMS, sir, and thank you to all the people